Like many of you, I have friends and relatives who are COVID positive. You may be staying away from your friends, your relatives, and worse, you may have small babies who are staying away from you. Many people have contacted me with questions like, what medicines should I take? When to check with your doctor or when to go to a hospital? What blood test should I get done? Do I need a CT scan? When to come out of isolation? Do I need to retest? And many more. Many of you may have similar questions. In this video, I'll give you simple practical tips. You can post your questions in the comment section below the video and I'll try to get to them as soon as possible. Make sure you watch till the end so you can get answers to all your questions. What is exposure to COVID-19? You're considered exposed to COVID-19 if any of the following you see on the screen happens. You get into close contact with someone having COVID-19. Close contact is you were within 6 feet within someone for 15 minutes or more. Number 2, you have a sick person at home. Number 3, you have direct contact with an infected person, like hug them or kiss them. Number 4, you're sharing eating or drinking utensils with an infected person. Number 5, the COVID positive person coughed, sneezed without a mask and somehow the aerosols got to you. When you have an exposure, you immediately need to quarantine yourself. Hear this carefully. If you develop any symptoms similar to COVID, even if you think you're not exposed, assume it is COVID and go under quarantine. Stay away from family members and wear a mask in the house. Follow precautions as though you're COVID positive. Don't panic. Don't spend your money to buy things like oxygen, medicines, this, that, etc. without checking with a doctor. If someone promises you of any cure, don't fall for it. There is no magical cure for COVID. The next thing is you plan to get tested for COVID. There are 3 things that are possible. One is your test results are positive. Second is your test results are negative but you have symptoms. And the third is the test results are negative and you do not have any symptoms. No matter which category you belong to, if you have an exposure, you should quarantine. I'll tell you what to do with each of these. If the test results are positive for COVID-19, continue quarantine for 14 days and monitor your symptoms. If the test results are negative and you have symptoms, continue the same. That is quarantine for 14 days. This is because some strains are not being picked up by the COVID test. Do not assume you're negative if you have symptoms. Next, if the test results are negative and you do not have any symptoms, you still quarantine for at least 10 days. This is because, as I mentioned earlier, the strain may not have been picked up by the test and also you may be an asymptomatic carrier and can spread COVID to other people. Whichever category you belong to, again, don't panic. Stay home and monitor your health. Wear a mask at home. Don't get close to any family members. Clean all the surfaces that are touched frequently, like doorknobs, countertops, tables, chairs, etc., using an alcohol-based spray or a wipe. Take rest and drink liquids to maintain hydration. So when do symptoms appear after exposure to COVID-19? Symptoms can appear anywhere between 2 to 14 days after exposure to the virus. This is a viral disease and most likely will cause one or the other symptom. You can see the list of symptoms on the screen in front of you. You may be familiar with this. So the symptoms include fever or chills, cough, difficulty breathing, feeling tired, muscle or body pain, headache, new loss of taste or smell, sore throat, congestion, runny nose, nausea, vomiting, diarrhea. When it is day 1 for symptoms, it means the virus had entered in the body 3 days before the onset of symptoms. The first symptom is often fever with cough. This can be associated with other symptoms that I just mentioned. Some people first have nausea, vomiting, and diarrhea, and then cough. Eventually, almost everyone with symptoms will have some degree of fever. On days 1 to 3, watch for fever. if you have a pulse oximetry, check it once in the morning, once in the afternoon, once in the evening, and once in the night. Continue taking a lot of fluids. Maintain hydration, do steam inhalation, and have a healthy diet. If you have fever, take paracetamol. I'll show the dose soon. Next, on days 3 to 5, the fever can get more severe. Continue paracetamol. If fever is not broken with paracetamol, then add ibuprofen or naproxen. You can take both paracetamol and ibuprofen together. You can see the dose on the screen. It is 650 mg paracetamol every 4 to 6 hours and 400 mg ibuprofen every 8 hours. Here is one example of how you can dose paracetamol and ibuprofen together. Take paracetamol 650 mg, one tablet at 6 a.m. Then you can have the next one at 10 a.m., next one at 2 p.m., next at 6 p.m., next at 10 p.m., and the sixth tablet at 2 a.m. You can have ibuprofen in between this. In this example, 400 milligrams at 8 a.m., 400 milligrams at 4 p.m., and then another 400 milligrams at 12 in the midnight. Many people recognize paracetamol 650 milligram as Dolo 650. I'm not endorsing any brand. The maximum dose of paracetamol in 24 hours is 4 grams, that is 6 tablets of 650 milligrams. Do not take more than this as it can cause liver problems. If you feel fine, you can always skip a dose. You can even start the first dose at any time of the day and maintain the necessary space between them. If you're a smoker, quit it now. Don't even think twice. Your life is more important than the smoke. Continue to stay away from family members, and especially elderly who have additional health problems. If you're treating a child more than 2 years of age, change the dose of paracetamol to 12 mg per kg per dose with a maximum of 75 mg per kg over 24 hours, and ibuprofen to 10 mg per kg every 8 hours, as you can see here on the screen. On days 5 to 7, there may be nausea, vomiting, diarrhea. It is important you keep eating and drinking so you don't get dehydrated. Medicines like promethazine or omeprazole are often given during this time, and these help with symptoms like nausea, vomiting, and gastritis. If you're otherwise healthy, then continue your normal diet, or else follow usual diet restrictions like limit sugar intake if you have diabetes and salt if you have high blood pressure, etc. If you have loss of taste or smell, it becomes difficult to eat or drink. You have to remember that hydration is very important, and it is important to continue drinking water, juice, milk, or coconut water, whichever you like. By day 7 to 14, you should start feeling better if you had symptoms. In a small percentage of people, the symptoms can get worse. Now, if at any time symptoms get worse, you will have to see your doctor. So the next question is when to check with your doctor. Here are the reasons you need to see your doctor. The list is in front of you on the screen. Number 1, if the fever is not controlled with the medicines described before. Number 2, if you continue to have severe nausea, vomiting, or diarrhea, which is causing you to get tired and dehydrated. Number 3, if you have a pulse oximeter, then you can do a 6-minute walk test. So measure your oxygen saturation first and then walk for 6 minutes at your normal pace. Rest your hands and recheck your saturation. If the saturation falls below 3% from the initial test, then you need to check with your doctor. If it is not possible to walk around for 6 minutes due to space and COVID restrictions, try to walk as much as you can and then check your saturation. If your saturation is below 94%, then make sure you recheck this by correctly putting on your finger or changing the finger. Change batteries on the pulse oximeter to make sure it is working fine. If it continues to be low, then inform your doctor. Even with this, don't panic. You can try different positions to improve oxygen levels at home. I have put links to my other videos in the description below. Check the ones on how you can improve oxygen in your body at home and how to do deep breathing exercises. Continue steam inhalation. Your doctor may prescribe a medicine called budesonide inhaler, which is a puff that asthma patients take in case of low saturation or shortness of breath, or both. This symptom usually indicates that viral replication is ongoing and there is active inflammation. What medicines are given for carrying at home? First thing, do not take any medicines on your own. The medicines that are given do not have any direct effect on coronavirus. The medicines are used to treat symptoms and other associated problems. I'm mentioning those medicines that are used in India on this day of recording. If you're not in India, check with your local doctor and follow the guidelines of your country where you live. The medicine includes antibiotics like doxycycline and azithromycin. Ivermectin is another medicine commonly used. It is a medicine used against parasites and has been found in some studies to reduce viral load. This is not used in many other countries, including the USA. Paracetamol is used for fever, like I mentioned before. In addition, cetirizine is provided to relieve cold symptoms. Zinc and vitamin C are for improving immunity. Other medicines are typically used in the hospital. When to go to a hospital? If the symptoms continue to get worse, or if there is altered behavior which indicates low oxygen in the blood and then in the brain, or if you have any chest pain, severe shortness of breath or difficulty breathing, you're coughing out blood, then all this may indicate observation and treatment in a hospital may be required. What happens if you develop any side effects with medicines? As you saw before, there are so many different medicines that are used that include like antibiotics, ivermectin, and many others. It may be difficult to say what medicine is causing side effects, and this is when you have to check with your doctor. Post any questions in the comments below and I'll try to get to them as soon as possible. Next is what blood tests are done. The doctors may advise you to do CRP, D-Dimer, and many other blood tests to check for inflammation. CRP is called C-reactive protein, and this tells you how much inflammation is going on in the body. Some inflammation is a good thing, but too much can lead to other problems. So if your CRP levels are increased, then it means more inflammation is ongoing. If the CRP levels are not normal, do not stress. Contact your doctor and they will determine if any additional treatment is required for this. Every person's situation is very different. There may be some lab variation, but in general, the normal values are less than 5 mg per 100 ml of blood, and if it's more than 100 mg in 100 ml of blood, it indicates too much of inflammation is ongoing. This is when steroids like dexamethasone is given to reduce the inflammation. If dexamethasone is not available, methylprednisolone is used. Do check with your doctor prior to taking any steroids, as they can have serious side effects. There are many cases of fungal infection like mucormycosis and aspergillosis occurring, possibly because of very high dose of steroids, amongst other reasons. These can cause major complications. D-Dimer is the other test and tells you if a blood clot is forming in the body. Normally, D-Dimer is not found or is very minimally found. It can be elevated in COVID patients for up to 4 months after the infection. A value of more than 1 microgram per ml or 1000 nanogram per ml indicates severe disease. Comment in the video below if you need to learn more about other inflammatory markers. Deep venous thrombosis, which is a blood clot in the leg veins, is common after COVID infection. Low dose aspirin can be taken, or in fact should be taken at a dose of 75 milligrams per day. This is particularly important for those who are overweight and have other medical problems like diabetes, high blood pressure, etc. In addition, it is important to keep moving around, which will help prevent leg vein clots. Drink enough water to maintain hydration. If on the bed, keep moving the legs to help with blood flow in the legs. Since blood clots can occur post-COVID, your doctor may decide to start on additional blood thinning medicines. So when is a CT scan done? COVID-19 is a respiratory problem, so a chest X-ray is done and a CT scan may be done. Chest CT is usually done after 5 days of symptom onset. It is a matter of debate if chest CT is really required, hence following your doctor's recommendation is very important. CT scan is usually done for the following reasons. Number 1, when there are symptoms typical of COVID but RT-PCR is negative. Number 2, there is a doubt that there may be clots in the lungs. Number 3, there is no improvement with symptoms with the regular treatment. Number 4, there are new problems on a chest X-ray, or there is a suspicion of fungal infection like mucormycosis. CT scan report gives a score based on which the severity of problems can be determined. If the score is more, it means the disease is more severe. A score of less than 7 is considered normal. 8 to 17 moderate and more than 18 is severe. Of course, there may be some slight differences in the way it is reported. When can you get back to your children or your parents or anyone in the family or friends? The overall recovery can take up to 14 days, so stay isolated for 14 days. Even if you feel fine before or you don't have any symptoms, do stay isolated for 14 days and be extra careful so you don't infect other people in your family and outside. If you're still symptomatic, continue isolation until you feel fine. Do you need to retest yourself? The possibility of a positive person transmitting the virus to others reduces in 2 weeks. You may continue to be positive for up to 3 months after an initial positive test, but the chances of viral transmission onto others is almost none due to low virulence of the residual viral particles after 2 weeks. So you do not need to retest to document you are free from COVID. Once you pass those 14 days and you feel good without any symptoms, you can step out. When to get vaccine if you're COVID positive? If you have not received any dose, you can get your first dose of vaccine approximately 3 months after the infection. Well, this is because your infection will have produced antibodies in the blood which will prevent infection in the first few weeks. So someone else can get the benefit of getting a vaccine during this time. If you had 1 dose and then become positive, the second dose can be taken after you come out of isolation. If you have already had 2 doses and then become positive, which is also possible, you do not have to take any additional dose. There is a very high possibility we all may need a future booster dose. The guidelines on booster dose requirements is still not clear. What should you watch post-COVID? There are many chronic health problems reported after COVID. Once you recover from COVID, continue a healthy lifestyle. Eat right and maintain physical activity. Continue monitoring for pre-existing diabetes, high blood pressure, your heart, your lungs, and take care of your health. I want to thank you. I recommend you subscribe to the channel and turn on the bell icon to receive an update when I release a new video. Please do like, share, and comment below. Take care and have a great day.